South Korea is expediting its COVID-19 exit strategy by lifting additional preventive measures. From Saturday, people entering the country will no longer need to take a PCR test within 24 hours of their arrival here. Our Kim Bo-kyoung tells us more.
The number of new COVID-19 cases is keeping its downward trend. South Korea on Friday reported 28,497 new cases. This is a fall of around 2,300 from the previous day and 600 cases less than a week earlier. It's the lowest number seen on a Friday in 12 weeks. There were 352 severely ill patients reported and 42 deaths. With such a clear downward trend, the government has decided to lift some of the preventive measures that have been in place. Starting October 1st, the requirement for inbound travelers to take PCR tests will be removed, making international travel much easier. However, a health ministry official said the system might come back in if necessary.
Starting October 1st, 12 a.m., South Korea is to lift the post-entry PCR test requirement. Those who show symptoms within 3 days of their arrival can get a free PCR test at public health centers. Yet the country might reintroduce post-entry testing if there is a need to strengthen the entry checks, for example, if a subvariant with a high fatality rate occurs.
Face-to-face visits at nursing facilities and hospitals have been restricted since July 25th due to the COVID-19 surge at that time. However, considering the stabilized COVID-19 situation and high vaccination rate, the health authorities have decided to loosen up the measures, including allowing face-to-face visits starting October 4th.
Before the visitors come, if they get a negative result using self-testing kits, they can visit whenever they want. Visitors should wear their masks and refrain from eating if possible.
Until now, only those at nursing facilities who needed to see doctors outside were allowed to go out. But now, those who have received a fourth vaccination shot will be able to do so. Though our daily lives are slowly getting back to normal, the health officials stressed caution in order to prevent a possible twindemic of both influenza and a COVID-19 resurgence. Kim Bo-kyoung, Arirang News.